Tonight we have Dr. Matt Schlechten, who I just personally am so grateful for because he was so key in helping a family member of mine when she went to CHPSA hospital. It was just last year, but it feels like so long ago. It was about a year and a half ago. And Dr. Matt was just, nearly instrumental in helping us get my family member through her treatment. And she had some acute situations, and Dr. Matt was really on top of that and helping in managing, that case. So Dr. Matt is a naturopathic physician specializing in the treatment of cancer. He received his ND degree in 2002 from the Southwest College of Naturopathic Medicine in Phoenix. He spent 15 years in private practice in Montana, utilizing naturopathic IVs and injections to aid the body in recovering from cancer. He then joined CHPSA Hospital in Tijuana and worked with a team of physicians, surgeons, scientists, psychologists, and nutritionists to devise and deliver the most comprehensive possible integrative medical program. He's now in private practice and acts mostly as a consultant, providing guidance to cancer patients on choosing therapies, clinics, and medicines which are the most pertinent to their individual condition and the most useful in their path. He does this by integrating what he has learned over 20 years about supplements, injections, IVs, procedures, and conventional drug therapies. It is his purpose and desire to provide a bridge for people in need to the therapies and medicines they choose as tools in their care. So Dr. Matt, it's awesome to have you, and I'm so grateful for your heart to help people. I think that's one of the your greatest assets, in addition to your training and experience. From talking with you, I just can see that you truly care about the patient first, and all of the rest comes second. And I wanted to invite you tonight to talk about why it's important for people to seek, professional medical advice when they get a cancer diagnosis, because sometimes people will, read a book or, find something that, they're in a desperate situation, and obviously that's understandable, and want to take action as soon as possible. But I think sometimes it's easy for us to freeze when we're in a critical situation and don't get all of the advice that they need from medical professionals. So could you share a bit of your perspective on that with us?
Sure. I mean, I think typically when people get a diagnosis, unless they're medically trained or have some medical background, it's just a wall of newness. Mm-hmm. I think, it's kind of like you're stepping into a dark forest. And as soon as you start Googling your condition, you're confused. And then if you type in natural medicine in your condition, now you're just gone. Because if somebody has, let's say, lupus, there's, a certain amount of confusing about what the disease is, how it works, what the treatments are. But if you type natural medicine and lupus now, you've got a whole camp over here saying essential oils is all you need. You got a whole camp over here saying you need IVs and hyperbaric and invasive stuff. And there's just a lot. Like, the field of natural medicine is huge, and it's not as well defined as allopathic medicine. If you go to any MD, you're going to get a basic standard of treatment. You kind of know what you're going to expect MD to MD. With an ND, they might focus more acupuncture. They might focus more mind, body, emotion release. They might focus more massage. They might focus more IVs. So, and everybody is convinced that their modality is good. It's very successful, or else they wouldn't be in that. And so you're just confused, like, well, what do I do? I think I can sum it up in, I was in college and I was buying a cell phone plan, and he had all the different 4 plans. And this one was 420 minutes, and this one was 560 minutes, but had a additional line. And this one had evening and weekend minutes. This is back when plans weren't as simple as they are now. And I was looking at these plans like, I think I need this thing over here. I was like, no, you need for what you told me you need this over here. It's like, no, really, I like the idea of this. And we went back and forth about 3 times. And he said, look, I do this. It's D. What you need is D. And it's like, okay, this kid is here in this booth all day, every day doing the same thing. He has a familiarity with this field that I do not. Trust him and let him pick the plan for you,
Mhm.
because it's, you want to be empowered as a patient with a diagnosis. You
Mhm.
are your primary doctor. Don't expect anybody to just take care of you. For the most part, it doesn't happen, and not because people don't want to, but it's just for each individual doctor, we have hundreds of patients. We can't fully 100% care for each case. You have to be the point
Mhm.
person on that job and
Mhm.
hire out the professionals you need.
Right.
So you have to be in charge. But I think a lot of people try to become doctors, which,
Mhm.
certainly it's there's common knowledge stuff. I mean, there's the internet's out there, and there's things that are certainly accessible to all of us, but everything looks good on the internet. If you just have a
Mhm.
label of
Right.
fenbendazole cures cancer, you think, well, all I have to do is take fenbendazole, cancer go away. I've done it 50 times. It doesn't work out that often. And the only reason I know that is because I've done this over and over and over again for 20 years. So there's times to access somebody's background and resources and let them tell you typically how this goes. Now, let's say 100 cases of melanoma all responded very well to a certain supplement. That's by no means a guarantee that the next melanoma patient that takes that same supplement is going to behave the same.
Mhm.
It's just it's a whole new ballgame at that point, and it could go either way. But you do notice certain trends, like squamous cell carcinoma. I've treated 60 of them. I kind of know how this is going to go for the most part, which therapies are going to work and which ones aren't.
Right.
And then you'll have somebody pull up in the internet, oh, well, this says this is all I need. It's like,
Right.
cool. And if that works, I will embrace it. But you haven't done this 60 times. And so there's a certain time to turn over, and I don't want to say put blind faith in, but at least allow a message to come from someone that has lots of previous experience. Because, and I have consultants too. I have people that are mentors to me. When they give me an idea, I'm going to roll it around in my head. And if it makes sense, I'm going to try it. Now, that idea has become my own. I'm not holding them responsible for how this procedure turned out. They gave a suggestion. I embraced it and said, you know what, this is mine now. I'm going to use it. And if it works, great. If not, I'm going to change gears. So the same way, if a doctor recommends something to you and you make it yours and you choose to follow it, you've taken a suggestion, you've gone forward, and now it's yours. You're still in control. You're still taking responsibility for this. But they can feed you good ideas. And it should, for the most part, make sense in your reason gifted mind. When you explain a therapy, somebody explains a therapy to you, it should make sense. Like, to me, the idea of chemotherapy in most conditions doesn't make a lot of sense. When people say like, you're going to have a year with this diagnosis or 6 months if you take the chemo, and when are we going to start? Right. To me, the logic just isn't there. And it's like, it's called standard. It's just what we do. You just need to trust us and do this. It's like, no, it's got to make more sense than that. There are certain things that aren't going to make sense simply because they're beyond a person's level of understanding. Maybe it's technical, maybe it's counterintuitive. There'll be a couple of examples like that. But I spent 3 years on the phone at CHIPSA explaining therapies to patients. And it's kind of logical. Like our system at CHIPSA makes some logical sense. And if you just kind of spell it out to people, they're like, I get it. That it's less invasive. The theory makes sense of why it would work. And then they kind of glom onto it. People that are minded that way, other people conventional minded that don't want to do it, great, go do conventional if that's what makes sense to you. But I think that, no matter how many mentors a person has, this is your cross to bear. You're the one that has to go through this experience. You have to feel good about that choice that you make, not that your spouse made, not that your doctor made, not that your family members made. This has to be your choice because you got to put up with good or bad how that turns out. And so it's really important for them to be behind it. So I always tell people after I explain it, now go home, sit with that, talk to your husband, pray about it, get a gut feeling about it. When you come to some sort of clarity about it, move on it. You don't want to make a rash decision on something this important, like sleep on
Right.
it. But 4 days, if you've come to some sort of peace and clarity about it, now make your move. Because for cancer anyway, with most people, time is of the essence. And most people, I would say, undergun it. They either don't think it's as serious as it is, or they think they have all the time in the world. My experience with cancer is people usually don't. That this thing, more often than not, people are wishing they would have done more and sooner. So I say once people have a good, clear idea of a game plan, move on it. It doesn't have to be perfect. Okay. And typically, you know, if you make a decision like surgery, that decision is, you can't really go back from that. Once that gallbladder's gone, you can't put it back in.
Right.
Most of the natural medicine stuff isn't so drastic. So if you do something and it didn't pan out the way you want it to, you can make a new choice later and try it again. So it's not like everything is hinging on this decision you make in this moment. There's other nexus points at which you can make new decisions, and a good mentor / guide can help you with those nexus points as well. So, you know, I like to tell people that let's check in 4 weeks on this process and see if it's doing what we want it to do. With most cancers, there's markers. There's either a scan, ultrasound, or something you can do with the liver. There's tumor markers that let you know if this is moving in the right direction. If it is, proceed. If it's not, it might be time to change gears. 4 weeks is a short amount of time, and for most therapies, it would need more time to soak in. But there's ways to confirm that this is doing what you want it to, so that it's not blind faith. Well, my doctor told me to do this, and I have to wait 6 months to see if I made a good or bad choice. It's usually there's feedback sooner than that. So once again, a doctor can be a guide, but proof's in the pudding. Reality will tell you if this is going the right way. And then you don't need faith in a doctor. Now you've got proof that this is going well, and then it makes it easier to make the next decision and to continue with that.
Yeah.
So I want to give kind of an overview of that.
Yeah, thank you. I think that's great advice to trust someone who has experience with, you know, your particular cancer, like the example that you gave. So what's the difference between, or how would you advise people on who, you know, which doctor to trust? Because you mentioned a doctor who's trained in conventional medicine is going to recommend chemotherapy.
Right.
That's what they do.
So here's the problem, is that our culture has trained people to have complete confidence and trust in the conventional medical system. If that were always the case, we wouldn't have a healthcare crisis. So obviously there are times that is the right appropriate choice, and a lot of times where it isn't. And so you can't just do what your doctor tells you to. And it takes some discernment to know which it is. You know, I have a unique background in that I am familiar and comfortable with all the kind of, I would say, low invasive naturopathic technique, acupuncture, chiropractic, herbs, homeopathy, but also kind of the more invasive, you know, mistletoe therapy, IV vitamin C, CK3, Apatone, GC-MOF, turmeric, some of the more harder core stuff. And then that CHIPSA was around a bunch of MDs and exposed to low dose chemo, cholestoxin, hyperbaric oxygen, direct ozone injection. So I straddle both worlds. And so I would say half of my time is spent talking people out of the conventional approach that they have been given, if it just flat out doesn't seem appropriate. You know, something like a low success rate. You got a lung cancer with a 4% success rate on conventional, and they're trying to twist your arm into it. We might look at something else. That said, I get a lot of other people who are convinced their essential oil is going to be sufficient therapy to beat this beast. And I'm talking them into a targeted therapy, which is less toxic than chemo, but can be very effective. So there is some discernment there. And there's lots of different varieties of integrative doctors. And it's very individual. Some are good and some just aren't. You know, an MD that takes a weekend course in acupuncture isn't an integrative doctor. You know, a naturopath that hasn't done more rigorous training in cancer isn't very much an integrative doctor. It's got to be somebody that's confident with both, and then can say when to go left or when to go right, or when to walk down the middle and do both. Right. So it is hard because you want to trust a professional that you've paid to help you with this decision, but there's a conundrum in practice right now where, you know, that conventional advice is guided more by finance than what's in people's best interests. And so it's hard to know when to trust. I mean, not that any one individual doctor doesn't want the best thing for their patients, but they're being trained in medical schools that are funded by pharmaceutical companies who have an agenda to sell more drugs. And that's going to have a bearing on the training. And so, but for the most part, you can just kind of tell, you know, like it should, as above, so below. It should make sense on a basic level. It should make sense on a complex level, on a deep level. Like it should kind of align and line up. And if it doesn't, then you might take another look at it.
Okay. Yeah, that makes good sense. And what do you think, because I usually advise people to get multiple opinions, like, you know, get the conventional side and the natural side and the integrative side. Do you recommend that people get multiple opinions from different doctors?
Yes. Listen to as many options as are available to you. Everything. Hear it all. Because you never know when, like in the future, it might be time to shift gears and do something else. Yeah, I think it's really important to know all that's available to you. And then you get to pick which direction you go. Like, you know, for me, I think the biggest crime is that most people didn't know that this was available, like an integrative cancer approach, didn't know it existed. You know, you go on the commercials and you know that Adderall exists for kids with ADD, but you don't know that there's IV turmeric for cancer. And so for me, it's that first, let people know all that you have to offer, and then close your mouth, sit back and see what they're willing to accept and what they want to do. So if I have in good detail explained all the options they have for their cancer and they choose not to do it, perfect, I've done my job. You know, they didn't go down a path not knowing something else is available. But I think a lot of this is just awareness. CHIPSA does a good job now with the marketing of getting access to a lot of people right as they're diagnosed. So it's not like 20 years ago where we would get them at stage 4, 6 months after they've exhausted all possibilities. Now it's like, you know, people come to CHIPSA 7 days after their diagnosis and they haven't had chemo yet. That's a newer phenomenon because of the internet. But it just shows that we're making inroads into letting people know sooner that there's more to it than just cut and burn.
Yeah. With people, you know, going so soon after their diagnosis, have you ever, because I feel like I've seen people kind of make rushed decisions about their treatment. Do you ever see that?
Yeah, like in an ideal setting, I think that people should start with the lightest possible intervention first, and then move to take the butter knife first, then go to the steak knife, then go to the chainsaw, but don't start with the chainsaw. So I think our society is set up exactly backwards. You know, they should start with naturopathic medicine first, then something more like an integrative approach, and then potentially surgery. If, you know, those others didn't quite do the job, but not surgery, chemo first, because it's harder to recover from. You know, nobody has a problem recovering from naturopathic medicine if it didn't go down right. Once the chemo's in there, now things are changed. Your immune system's weaker and there's toxins in there. Not that it can't be recovered, but it's harder. Whereas with naturopathic medicine, the butter knife, if it didn't cut all the way through the cheese, you still have another chance with a steak knife.
Right. Okay. Yeah, that makes good sense. Do you recommend people research their specific type of cancer and what kind of doctor would be able to help them the most with that?
You know, people will come in and say, well, what do you do with B cell, you know, B mantle cell lymphoma or something like that? I know, are you an expert in that particular, you know, what I've found is that, and I'm not going to use lymphoma because I don't have a good response on Western side, but let's say lung cancer. You know, I've got non-small cell lung cancer, and I've got the best doctor at Scripps Hospital, and he's one of the top 3 guys. It's like, well, a really good doctor or at the bottom of the barrel doctor, they're going to be doing the same treatments. You know, it's the same stuff. It's, you got a immunotherapy and maybe a targeted and some chemo, and that's kind of the same across the board. I would rather have somebody that had high success rates with lung cancer. So, and to be honest, as a naturopath, a lot of my approaches are very similar, cancer to cancer. So I might treat a clear cell renal cancer similar to a lung cancer, because it's the same principles. We're going to wound that tumor with something like a low dose chemo, and we're going to crank up the generalized immune system to go after it. It's going to go after it, whether it was in your kidneys or your lung or your bone or your brain. So it is a little bit more generic. You can approach a lot of different cancers the same way. Certainly, like for me, non-small cell lung cancer is something I have a lot of experience with, and I have individual tricks, namely inhaled medicines. You know, GC-MOF in a nebulizer, so it goes right to the tumor site. That's unique for lung cancer. Targeted therapies like Tagrisso are really good with lung cancer, not so much with melanoma. So there are a couple of nuances, but a doctor wouldn't necessarily have to be an expert in that specific disease to be useful.
Great. And do you have any recommendations for how to find a good naturopathic doctor or integrative doctor?
I know a lot of them. For whatever reason, I went to school, the 4 years I was in med school, when I'm on the phone now and people tell me who their doctor is, it's usually somebody I went to school with. Like not just from my school, but from that period of 1998 to 2002. Like all my buddies are running all the major centers in America. There's good ones and bad ones out there. You know, it's something that a lot of people have a desire to work with. It's easy to read a couple of supplements and say, oh, I'm going to give everybody reishi mushroom and I'm curing cancer. But it's the ones that are good and have really been in this wrestling match a long time is who you want. And it's going to be hard to discern who that is. There's a handful of doctors I trust. I didn't realize that there aren't as many, like there's a lot of mid-level practitioners that I think do a pretty good job in supporting a patient with cancer, but maybe wouldn't be comfortable being their only doctor with cancer. Like if they want to do chemo and radiation, I'll help mop up the side effects. But if you're going to be a freestanding, I'm going to beat this cancer just with natural stuff, they're sparse. And I didn't realize how sparse it was until I was in Montana. I had a patient in New Hampshire, 6-year-old with lymphoma, and said, I want to come in for Laetrile for whatever, you know, that was what the therapy they wanted. I'm like, well, I'm sure there's somebody closer than me for Laetrile. And I started doing a search in New York and Connecticut and Massachusetts. I called back and said, you're right. I am your next nearest stop for Laetrile. Fly him out. So I was surprised at how hard it was to find integrative cancer docs. So, and I'm happy anybody on the call that has a question, like specific question, like I have this and I'm here and who do I go to? I'm happy to just give them that.
Wow. Yeah. So do you recommend finding someone who's closest to you who can administer IVs, or how do you?
I mean, it's because, especially for naturopathic medicine, it's regulated state by state. So it's not federally recognized. So state by state, you have to apply for a state to be a naturopathic medical state or not. And I think there's 18 of them. So if you're in Arkansas and Louisiana and Mississippi, there's just none. If you're from Portland or San Francisco, there's going to be 1,000. So it really just depends on where people are. Obviously, some sort of practitioner with an arm's reach of them is needed, because if you get an infection that needs to be addressed, that's not something a consultant can do over the phone. What I'm mostly doing right now is more phone consulting, like kind of the broad sweeps, like these are the therapies you should do. I know somebody in this town that can administer those. Let's check in once a month and kind of change gears if we need to. So you can have sort of like global guidance with local support.
Okay. Yeah. And so, yeah, that's great. So anyone can reach out to you, basically globally, right?
Yeah. As long as there's internet and phone, we can talk to anybody from anywhere.
That's great. And so you charge hourly. Is there a certain time that you, amount of time that you generally spend on the phone with someone?
I mean, if somebody is like, I just got a diagnosis, I need you to ship me to somebody, I'm not going to charge for that. That's just kind of a referral. If I'm sort of the guy figuring out the case and putting supplements together and putting an IV package together, it is $300 an hour. It never seems to go an hour unless they're really a talker. Because you get people that'll talk your ear off for 90 minutes. But I would say my average phone consult is 15 or 20 minutes. So it's like a 75 or $85 or something. The first one might be longer, but I talk fast. So it seems like 15 minutes is plenty for most people.
Yeah. They get
that's doable. That's cheaper than, any MD's brief visit if you had to drive downtown and go to an office building. So it's manageable for most folks.
Yeah. It's super quick because you can do it from home. You can do it from your car.
Yeah.
You don't have to go anywhere. That's really very convenient, I think. So could you share with us a few success stories that you have with working with people?
Sure. So there's going to be, I'll give you two that I can think of. There's, so sometimes I'm the primary. I'm the guy actually putting the IVs in. Sometimes I'm the consultant. As a consultant recently, man left Chipsa with stage 4 non-small cell lung cancer all through his lungs, spread to liver. It just didn't look good. And it wasn't responding to anything we were giving him. He, I said, has your doctor recommended a targeted therapy? Which they had not. And I said, go to your doctor, ask for a biopsy of your tumor to break it apart, look at the genetics and see if there's a targeted medicine that's appropriate for you. He did. He was prescribed Tagrisso. 4 months later, now he's cancer-free.
Wow.
Like, to be honest, I didn't think I was going to see this guy again. And now he's going back to work.
Wow.
So, that's an example of just how a little feeding of some information changed this man's world. It's just something he didn't know existed, connected him to that dot, and now he's better.
Wow.
Another case where I was the actual primary doc, it was renal cell, so kidney cancer. He called it stage 13 cancer because it was spread to 13 places in his body. It was like scapula and spleen and appendix and pectoral muscle, and they were quadrupling in size every 3 months.
Oh my gosh.
Yeah. And the curve was reaching way up. We did turmeric and Laetrile and ozone and glutathione and artesunate, GC-MOF for 6 or 8 months, I want to say. I think 2 or 3 IVs a week. And then he didn't want to spend the money anymore. And I didn't talk to him for a year, which isn't a good sign with cancer. And then he called me up like 4 months ago and was like, hey, doc, just wanted to call and say hi. I was like, oh, hi. Hey, he tried not to act surprised. Cancer-free.
Oh my gosh.
Yeah, stage 13 cancer. Now he's back on, he's a roofer. He's back on the roof doing work.
Oh my gosh.
So, it can be done. It's, I think early in practice, I was very naive and just assumed you could cure anything. If you just put the anti-cancer stuff into the people with cancer, you're going to get the result you're looking for. And I often did, like 60% of the time, I want to say. And I was really upset about the 40%. I was really heartbroken when people didn't make it. I was like, well, I put all the right stuff in and what happened? That's cancer. Sometimes you do the exact perfect plan. It's not in the cards. As I came into the broader sort of world of integrative doctors, and it was like, oh, I've got extraordinary results. Like, we're not used to seeing 60%. We're happy with 13% or 14% or something like that. So I'm just pleased that it works out as often as it does for something that I'm not in control of. You get people calling on the phone, they want to guarantee, well, can we guarantee this would work? It's like, I would love to guarantee this would work. I don't want you to die. I want you to be there for your kids, but it's not up to me.
Yeah.
God didn't put me in charge of that. He
Right.
put me in charge of trying to figure out what things to put in needles to put into you. That's
Right.
all I can do. I would love for it to work out every single time,
Mhm.
but all I can do is do the best job I can at finding tools to support, but it can be done. You know, I have a lot of sort of rationale by how I pick different stuff for different cancers. So there's like a theory. It's like an idea. The rubber hits the road when you watch people do that theory enough times and pull out of it to see it work. And it's like, okay, well, that idea panned out. Like it was a good idea for this many people that are now, 6 years out and cancer free. So, when people call in and ask, like, I just got this diagnosis and my doctor said there's no cure and it's going to be terminal. And I said, well, he doesn't know that. And I don't know that, but I've seen other people worse than you walk out of this. So I know it's at least possible. I know that there's a % chance that you can do this, and let's approach this as if we could win. Let's set it up that way. If the bar is here, you want to aim to high jump over that bar. You don't want to aim like you're not going to make it. At least aim like you might not make it. You might hit the bar and fall on your butt, but if you make the plan as if you're going to go over it, you might. And I'm amazed at how often that works. Sometimes it surprises me. People that it was just like, oh, there's just no way. This is just too much, and pull out of it.
Wow.
So I always hold out for that. I don't want to be the one to give up on somebody and tell them when they are not going to make it.
Right.
That's God's going to determine that as it unfolds. So I always give it a try, no matter how unlikely the case looks. I always think if there's at least a 1% chance, let's angle it that way and aim for it.
Yeah, I agree. Because I've been surprised sometimes too. I'm like, oh gosh, this person is, they're not going to make it, and then they're still going, and I'm like, oh my gosh. Well, I'm
and
sorry.
Then wouldn't you felt stupid if you would have gave up on them,
Yeah, just felt bad, but it's just encouraging what, like you said, what God can do. So I want to go to the Q&A section now, and there's a question from Cindy on Facebook. She said she's getting ready to begin the COC off-label drug protocol. I went from having
COC. Which one's that?
Care on. It's the oh my goodness, I'm blanking on her name. Someone
like
here.
Fenbendazole and doxorubicin.
How to so she says, I went from having inoperable advanced metastatic MMR endometrial cancer to having no evidence of tumor or FDG activity on PET scans after 6 months of Keytruda. Is this frame of thinking right or wrong? I figure this is the best time to find and destroy circulating stem cells, right or wrong? My oncologist is keeping me on immunotherapy for the full 2 years, ending December 2021. Thanks.
And she's wondering if the COC is a good addition to that.
Yes, she had inoperable, and she has no evidence of cancer as of right now after 6 months of Keytruda. So she just wants to eliminate any remaining potential of cancer stem cells.
So
and she's continuing for another year of the immunotherapy.
Okay, let's talk about the immunotherapy first. Keytruda can be fabulous. It doesn't work as often as it's touted. It's something that seems to work. I'm totally in the way here. It's something that seems to work for about 20% of the population. When it works really well, but it's 1 out of 5. There's a risk with continuing it that long. Like it's behaved fabulously, like it's done what you would hope Keytruda to do, and I understand why they want to continue. There's a potential risk in continuing in that if the immune system is red hot and there's no tumor to attack, it can attack you. Okay, they call it wrong target syndrome. In that if you are all dressed up with nowhere to go, you'll just start dancing with anybody who's there. So what that can look like is your immune system attacks your colon and you get diarrhea, or your lungs and you get like a pneumonitis. So I would say watch for that and be prepared to stop the dose if something bad happens. The COC, I think, it's not going to hurt. I haven't done it enough times to be convinced that it's something I'm going to have in my tool belt. There's just other things I use that are more consistent than that. I've seen a couple of cases really respond to it, but not to match the hype that it has on the internet. And if that person wants to call me, I'm happy to share a couple of tricks on cancer stem cells that would be useful. So I would say go ahead and do the COC because it's not going to hurt, but I would go probably further than that. And if you can, get a circulating tumor cell count to get a sense of how many cells are floating.
Thank you. Do you have any recommended companies for this circulating?
I just use the Greek people, RGCC. Okay. There's others out there, but that's the one I use.
Okay, cool. Okay, great. So anyone who's on the call now, if you have a question, please unmute yourself and ask away.
I have a question.
Hey, Jennifer.
Hi. Thank you, Bailey. So 3 years ago, 3.5 years ago, I was diagnosed with pleomorphic liposarcoma. And the sarcoma that I had grew in size from 7 centimeters when we found it to 15 when they finally did the surgery after radiation and a few vacations that the doctors took. The surgery was successful. They did do radiation before the surgery, which caused a lot of problems, but I won't go into that. So since then, it's been no evidence of disease for 3 years. And my oncologist checks my lungs on a regular basis because he says it likes to metastasize to the lungs. But honestly, I haven't asked him, well, what are you going to do if you find something in the lungs? Because when it was in the leg, they told me chemo is not effective with sarcoma. Right. So I don't know what they would do if they found it in the lungs. And I just want to be prepared with a plan in case they do. I wonder how much experience you would have with sarcoma because I know it's pretty rare.
We see a lot of patients at CHPSA, so I saw probably 1,200 patients during my 3 years down there. And I saw 4 big basketball leiomyos, usually in the abdomen, ginormous. Like you couldn't believe a thing could get that big. And chemo doesn't work real well with that. Coles does work really well with sarcoma. Coles is kind of a funny animal in that it works really well and it's super illegal. So it's something that has to be, you have to get it in Mexico. That would be one option. I haven't treated leiomyo with anything other than CHPSA protocol, which is going to be ozone, hyperbaric, Coles. Now they're getting into dendritic cell, and there's a anti-angiogenesis vaccine, just kind of combination that way. Very effective, very expensive. There's probably another way to skin that cat, but I haven't tried it yet for that. And like I said, you're in a good place now. 3 years out is a good sign for that. And yes, you want a different plan B if it comes back because chemo is not going to be the right answer there. There's kind of a... So it was neat for me to go to CHPSA to work with a whole bunch of illegal stuff. Things that I'd read about and were effective, but I couldn't use in Montana. The trick now, being back in the States, is how much can we do legally? Like what's the translated version that's FDA happy here in the States? And it's tricky. It's things like mistletoe and curcumin and artesunate, kind of fancier, higher voltage naturopathic therapies that will approach what you can get south of the border. So probably something in that neighborhood would be the way I would do it.
Do you have any recommendations for like prevention, I guess, for preventing a recurrence?
Yeah, I mean, I like Gerson, even if it's not 100%. I think long-term Gerson isn't that practical, but something with a little more protein, a little more fat, and a little more flavor, I think is more sustainable long-term. But the enemas and the juicing, they don't just detox the body, which is important. You think about all cancers, if not caused by or at least affected by toxicity. Like there's something fake in your body that's rotten on your DNA and turned it into cancer. So washing all that stuff out of your body makes sense if you don't want to get cancer, if you don't want it to fan the flames of a cancer. So I think the detox is helpful, but that diet itself actually stimulates the immune system. It like bangs the matrix and makes it wake up and do stuff. Keeping your immune system on a little higher gear is always a good idea. There's some tricks, like GM-CSF is a shot that it goes in the belly that brings more white blood cells out of the bone marrow into circulation, just putting more soldiers on the field. That's a trick to keep your immune system in surveillance. So like right now, you've won the war, you've occupied North Korea, but you probably don't want to leave the border open with no standing army. You want some troops sitting in there looking at stuff. So something like the GM-CSF might be a good solution. They've done some studies on like melanoma, where they had two groups, like 600 patient study. One group with two shots of GM-CSF a week for a year, and one group without. And the group with the GM-CSF, the survival rates were 3 times longer, just across the board.
Is it possible to use that circulating tumor cell test to find sarcoma?
Maybe. So the CTC isn't an exact diagnosis for cancer. I know lots of people with circulating CTCs that don't have cancer. I know lots of people with cancer that they don't show up. Okay. So it's not a deadlock, but it's measurable. So if you came out and it was 3, and then you did some stuff, and 3 months later it was 2, you would probably say that it has some bearing on your disease. And if your numbers went to 4 and then 6 and then 8, I would be doing some scans. So it's not diagnostic, but it can be correlative with what's going on with you.
Okay. So I'm having some issues with the leg where the cancer was removed because they had to take a pretty big chunk of my leg. And I'm having some difficulty walking right now. So my oncologist wants to do an MRI of my entire pelvis to see if there's any kind of metastasis or anything going on in there. Would you say go ahead and go with that?
Absolutely. MRI is clean technology. It's not radiating.
They always hand you that piece of paper that says this could, cause some brain issues with the contrast. So I've done so many of them, and I'm having some memory issues. So I'm like, do I keep doing this? But
I would, because the side effects of the memory issues are a drop in the bucket compared to what having a new leiomyosarcoma would do. So I think that's a worthy trade-off. Okay. And it's not like you have to get a CT every 3 months and pump yourself full of radiation and stuff. So I would say do it, because that's all you've got is that scan to check. And if God forbid something were to come up and you didn't check it for a year, then it had maybe 9 months to grow and make itself known, and you want to know sooner than that. So I think that's a pretty good maintenance protocol for you. Would be a, whatever it is, 3 or 6 month MRI.
Okay. So when you're talking about the Gerson and this, I'm not familiar with the GM-CSF, and then doing like the detox, is there anything you recommend for detoxing other than doing the juicing and the enemas?
Yeah, there's specific nutrients that your liver needs to break things down. So liver works in a phase 1 and phase 2 detox. So phase 1 is inducible, meaning if you get carbon tetrachloride come into your liver, it's going to automatically put open up a side group. The phase 2 conjugate is like a cork that fits on the end of the molecule. And those corks you'll run out of. They're amino acids mostly: glycine, glutamine, N-acetylcysteine, glucuronolactone, taurine. So there's detox powders. I mean, detox is another big garbage bag term that's kind of like natural medicine, and that it could be anything. But specifically, if it has a bunch of amino acids in it, it's probably useful for detox. I do those on top of Gerson, just to give yourself the more specific detox nutrients. And if you want, I'll leave my cell phone number at the end of this talk. I'll just text you what those ingredients are, and you can go to Whole Foods Market and look on labels of stuff and see if you're getting the right stuff.
Okay. Is there any, I'm in Texas, Are there any doctors that you know in Texas that you feel confident
No.
about? No?
Pick a new
Anybody
state.
close to Texas?
Oof. Well, Texas isn't close to anything because you have to get out of Texas.
True. And I'm in central Texas. Well, at least
Arizona,
I'm starting in the middle.
Arizona would be the next nearest where there's going to be a bunch of talented people.
Okay. All right.
And happy to hook you up with a whole bunch of people. But Jake Pasenka is good. The Oasis of Healing in it's Dr. Lodi in Arizona at Phoenix. He's good. Of course, I'm going to forget the name of the guy that's the head of the oncology department at Naturopathic Medicine. What is that guy's name? Daniel Rubin is good.
And that's in Arizona?
They're all in Phoenix.
They're all in Phoenix. Okay. All right.
Ken Profrock, Proefrock, is in Sun City. He's got a couple doctors working with him. Those guys are all good.
Okay.
Can you spell it one more time? Ken
Proefrock.
Thank you. And the first one before Daniel Rubin?
Dr. Lodi, Lodi.
Oh, I think there was one before him.
Jake Pasenka, Psenka.
Thank you.
Yep.
Thank you. I really appreciate that information.
Okay.
Yep, you bet.
I have a question.
Yeah, go ahead, Laura.
Well, this one's kind of complicated. My fiance had hepatitis C, and he was given 2 doses of that new medication. Trying to think what it was called. Horrible side effects.
Interferon or the drug?
Pardon me?
The interferon shots, or was it the oral drug?
No, it was a drug. It was a drug.
I know what you're
And
talking about.
so the liver had gotten so bad with cancer cells that he had like 3 or 4 chemoembolizations because he was on the liver transplant list.
Full of cancer or full of scar tissue from the Hep C?
Both.
Okay.
And so they were doing the chemoembolization to try to get those cancer cells out of there until the liver came in. This January, it will be 2 years since his liver transplant. The liver is doing great. The problem is, and they told us this going into surgery, that sometimes when you transplant and take that diseased organ out, cells might move to different areas of your body.
Mm-hmm.
Well, that has happened. We found out about 6 months ago. So now he has liver cancer in a lung and a half.
Okay.
So he has taken oral chemo. He met with the thoracic surgeon about 2 weeks ago to see if the thoracic surgeon could actually take out the larger nodules.
Yep.
The thoracic surgeon took it to the tumor board. The tumor board voted it down because of quote unquote all the different surgeries that he's had. I mean, the guy could walk steps, he could walk a football field. He's in good health because of this. So now we're kind of like, well, where do we go? Do we go to a bigger facility? We're in Charleston, South Carolina.
Yeah.
And so it's kind of like, I don't know what, I'm a big believer in natural medicine. I was in medical sales, but I was in nutraceutical medical sales, not drugs.
Right.
And so we just kind of don't know what route we need to go now.
So the trick is liver cancer isn't something that responds well on the chemo side. And I'm not totally opposed to chemo. I've seen it do wonders with leukemia, lymphoma, certain things that really has a good match with. Liver cancer is not one of them. So you have that cancer type in the lungs, which is also kind of hard to address. Yeah. So whether it's a bigger center isn't going to really change their approach.
Okay.
I would jump ship and try a whole different thing. Okay. It's something that's aggressive and is going to require big guns, more than you'd want to do with over the phone or a health food store or something like that. Something like one of the south of the border clinics is probably your best bet for that. Like Chipso would do a pretty good job with that because the lighter dose of chemo, which isn't designed to shrink the cancer, it's designed to show it to the immune system. Because by scratching that cancer, some of their genetic information leaks out, immune system can jump on it. So I would do a what if with those guys, like call the number and then they go through a talk with the doctor there, and they'll
Okay.
see if this is a good fit and what it cost and what the likely benefit would be, things like that.
Well, and they told him he was not a candidate for immunotherapy because of being a transplant patient.
Right. You don't want your immune system attacking your liver.
Yeah, yeah.
Yeah.
And then, I mean, I do some juicing and I try to do a lot of vegetables.
Mhm.
And, you know, he loves meat. He's a meat eater. And so I said, you know, I also believe in these natural supplements. I believe that they can make a big difference too. But as you know, when you were kind of referring to earlier, you know, you got the COC protocol, you got this protocol, that protocol, then you end up taking 15 or 20 different supplements. And it's like, yeah, you know.
And with each case, you have to match the strength of the therapy with the strength of the disease. In this case, he has a DEFCON 5 level disease. It's going to need ballistic missile level medicines. So supplements would be good as a background, like you're going to want those in there, but you're going to want some shot and IV stuff in to get to address the size of this beast.
Okay.
So
we're on the East Coast and in the United States. So then basically there's nothing in the States that I even need. Okay.
Maybe in the States, like maybe something like the, you know, the Lodi Clinic in Phoenix or something like that. But on the East Coast, there's not going to be much.
Okay. Okay. What about Mayo Clinic?
Once again, it's a very fancy clinic doing the same ineffective therapies that you're going to get in South Carolina.
Got it. Got it. Okay. Thank you. Thank you.
Yeah. And happy to help out more with that if you want to chat later.
Yes. Yes. And your information is.
So I think she put it up on the.
Yeah. Got it. There. Got it.
Yeah.
Okay.
Yeah. Put the number. I'll add his email too.
I have a quick question, doctor. Can you hear me?
Yep. Trying to find, there you are.
Yes. So I was diagnosed with Mycosis fungoides, a form of skin lymphoma susceptible just only on the skin. They did a PEP scan, they did blood work. Nothing was in the PEP scan or in the blood work. They recommended UV light therapy. I did that for maybe 3 or 4 months, and I noticed it was I was having hyperpigmentation, and they noticed that my skin complexion has, you know, come back along with me sitting in the sun for maybe 20, 30 minutes a day. And so any holistic medicines or just any other suggestions of what I should do?
And what part of the country are you in?
Georgia.
I would find, like in your case, you know, this would be more appropriate for light level naturopathic stuff. You know, I'm thinking like IV vitamin C. Okay. Like if you just Google that, there'll be somebody in Georgia doing it. Maybe not a naturopath, but certainly a complementary MD.
Okay, and that would help with the T cells. It's just, they said it was the biopsies just said subtle, but spares, but clinical evaluation, I guess, with looking at me presently, what they suggest, I guess.
You got a little just touch of cancer on the skin. You want something that's going to hit everywhere. A local treatment, like something like the UV is great. You should keep doing that. That's good. But you need something that's going to hit every cell in your body. Something like an IV vitamin C is going to go in your arm, and then it's going to go systemic, and it's going to hit all those cells. When combined with something like far infrared sauna, you know, the dry kind, not the hot rocks or steam sauna, but the infrared saunas, you're putting a moist organism into a dry box, and it encourages water to move out of you, so you sweat, and it's going to help move toxins and badness out through your skin. It can actually help with that skin condition, especially when combined with the vitamin C, because it'll start to kill those cells a bit, and then the sauna can kind of blow them off.
Is there a certain level of vitamin C in the IV I should take?
Above 50 grams. They're going to want to start you slower, but ramp up to 50 grams at least.
Okay, and the doctor would do that? Because I used a VA doctor, and
they're not going to do it there.
So that would be outside treatment?
Yeah, it's going to be a alternative MD that's kind of dipped his toe into the naturopathic formulary and does vitamin C. But if you just Google IV vitamin C, somebody's going to come up in Atlanta.
Okay. Should I be alarmed with the mycosis fungoides? It hasn't gotten worse since a year. It's just kind of gotten better as far as my skin. So should I be concerned about it getting worse to the lymph nodes or the blood?
I would definitely treat it. You don't want that hanging out. It's not aggressive, but it's not probably going away at the rate you want it to. So I would definitely address it.
Okay.
The other almost specific treatment would be ozone sauna.
Okay.
So ozone is something you use to clean out the stink in your garage. It's just like looks like an air filter, and it blows O3 to
Yes.
kill chemicals and odors. You can do that intravenously as an inside therapy. They draw blood out of your body and then shoot ozone into it and drip it back in. But in your case, because it's a skin condition, you can do a ozone sauna. It looks like a Russian box sauna. Your head sticks out, steam gets pumped into the box, and then they just port ozone right in the side, and you get anti-cancer medicine floating all around, hitting the direct contact with the tumors.
And how long would I do that for? I guess the
half
sauna?
an hour, twice a week.
Twice a week. And then the IV for vitamin C?
Yeah, once a week.
Once a week for like a couple of months, or?
Until it looks better.
Okay, so then we have to do biopsy again, or till the skin condition look better?
Yeah, till it looks, you can just do it visually, till things look better.
Okay,
And so ozone sauna, you can just Google. It's like they wouldn't have to even be a doctor to have that. It might be a spa might have that.
Okay.
If there's flat out nobody near you, talk to me and I can help you find how to buy one.
Okay.
It might be 3 or 4K or something, and then you have it in your basement and you have it the rest of your life.
Okay.
So that would also be an option.
Thank you so much.
Yeah, you bet.
Okay, I have a question from someone. She's in Tucson.
Mhm.
I know you already gave several recommendations, but she said, I was just told today that the nodules in my lungs are from breast cancer I had years ago, secretory breast cancer. The doctor is sending biopsy for more information, but when I asked what type of treatment I will need, he said chemo. I don't understand how he had, could go straight to chemo without knowing exactly what type of cancer I have.
Well, he's saying chemo because he can't really radiate that part of the body and it's not really surgically appropriate. So that's all he's got. And not to say chemo might not work in that instance, has a pretty good track record with breast cancer cells. It's harsh and there's side effects, you lose your hair and things like that. So in terms of me trashing on chemo, this one would be, you might do that, you might not. There would certainly be lighter approaches that would be more effective and gentler on her body. And I'd be happy to go over some of those with her. Yeah.
Thank you. Okay. I saw someone unmuted. Did you have a question? Please unmute yourself. Jennifer, you have another one?
Yeah, you were talking
ahead.
about IV vitamin C, and I do have a doctor nearby who does IV vitamin C and IV glutathione. And also there's another doctor who's got ozone and sauna. I was just wondering if you think those would be beneficial.
Probably.
Okay.
It's always good to have, because vitamin C, it detoxes chemicals, it detoxes metals, it, freshens up the immune system. There's lots of things it's doing that are useful. It's going to be more useful in a flat out active cancer situation, which you don't have. So it wouldn't be my first reach. I think they're useful, but it's not my first reach, because what we need for you is just kind of more preventative maintenance than active treatment. So it's like it's an 80% good fit, but not 100%. So it's not going to hurt yourself. Certainly do it, but it's that would be more useful for the gal with the breast cancer in her lungs, where she's got active tumors that need to be kind of oxidized.
Okay, and I was wondering with ozone, I know I used to have an ozone machine that they quit selling them. I guess they were causing breathing issues, and I remember feeling like it was hard to breathe using that ozone. Are there dangers with using ozone if you have an ozonator kind of machine at home?
The only place you don't want ozone is in your lungs.
Okay.
You can do it rectally, you can do it vaginally, you can do it on your skin, you can do it in your ear, you can do it in your blood, but you can't breathe it. Okay,
Okay.
it's an irritant, makes you cough. So the ozone machines, like in office buildings, to kind of keep the hallways clear, are good, but you shouldn't do them when you're in the room. And you don't ever want to breathe ozone.
So if we have a doctor here who's putting it in like nasally, like
Yeah. So
that's
there's
okay?
a trick. There's a trick with that, and that you take a deep breath in, then you shoot this thing up your nose,
Right.
and then it kind of burns all the snot out of your head, but then you exhale.
Right.
So there's a timing thing with it so that you don't inhale it.
Gotcha.
But
And
sinuses is fine.
is there any problem with it killing off all the good bacteria like an antibiotic would? Okay.
No, it doesn't seem to, like, because they do rectal ozone for lots of reasons, but also colon cancer, and it doesn't give people the dysbiosis that like an antibiotic would.
Okay.
Yeah.
All right. Thank you.
Yeah, you bet.
All right, Yesenia, do you want to ask your question?
Yes. Hi, can you hear me?
I can, but I can't see you. I'm trying to find you in my little. Oh, there you go.
Okay. My room is a little dark. Hi, I'm Yesenia. I'm the one that Bailey just asked a question about the breast cancer going to lungs.
Okay.
Yeah. I actually have a hyperbaric chamber at home.
Yep.
Would that be something that you would recommend? I kind of stopped it because I did hear from someone else saying that maybe my type of cancer likes oxygen. So that freaked me out. So I kind of stopped.
I don't buy that. You know, they're going to want to assess you. If there's enough tumor in your lungs that it's compromising that lung tissue at all, you don't want to put a bunch of pressure on it, because it's like putting a balloon in a pressure chamber. But they'll know, like, if it's a good hyperbaric place, they'll give you a chest x-ray and say, like, yes or no, you come in. I don't think it's going to feed the cancer, the oxygen. I don't buy that. I think it would be supportive, like giving more oxygen to your cells to work better, especially in your immune system. I don't think it's going to be an anti-cancer therapy. So we use hyperbaric in our clinic at CHIPSA, but we don't pretend that it's anti-cancer.
I see.
Okay. Yeah, there's other things that do the job of wrecking cancer cells. That's not so much one of them.
Because you just mentioned that vitamin C would probably not be good for me.
I think it would be good for you.
Oh, it would be good for me. Okay.
Yeah. And where are you located?
I'm in Tucson, Arizona.
Okay, yeah. So a bunch of naturopaths in Tucson, and then there's even more in Phoenix, and they would all do vitamin C and ozone. They would have 100 therapies for you. Artesunate, write that one down, is very
what
specific. Artesunate, ARTESUNAT.
I am going to get a second opinion. I was thinking of going to Cancer Center of America in Phoenix, but you mentioned all these doctors here.
Yeah, I think like the CTCA, Cancer Treatment Centers of America. I think they're worthless. I can say that because I've had a lot of classmates go to work for them. They're basically an MD, straight up conventional setting with a garnish of a naturopath on staff, that all they get to do is design the diets, basically. It's not frontline natural medicine. It's just basically marketing gimmick.
Got it.
So I'm not a fan, and they don't get that good of results. You know, it's not working either. So there are folks that are doing more frontline, use the natural stuff to beat the cancer down rather than just use the chemo. And especially in that Phoenix area, there's a bunch.
Yeah, I'm not really, I'm not leaning towards the chemo. So I will look into it, these doctors that you mentioned. Thank you.
Yeah, you bet.
Thank you.
Yeah, and just to add to that CTCA, I went there for a second or third, fourth, fifth opinion, and I found it the same as you're describing, Dr. Matt. It was just, you know, more marketing than you know, quote unquote meat. So, oh, we lost your audio. I think you're muted. Yeah.
How am I now?
Yeah, you're good.
Okay. Yeah, I just, you know, people that have been on the inside were just commenting that they weren't allowed to use their full scope as a naturopathic doctor to the best of their ability. They were just being asked to be a nutritionist, which is a sad misuse of resources.
That's too bad.
Yeah.
But thank you for sharing that.
Yeah,
that helps bring clarity to it. Okay. I got a question. Someone asked if ozonated water is okay.
It's okay. Certainly it cleans the water out. You'll
Mhm.
get a little bit of ozone that stays with it long enough to absorb it a little bit. It's not like you're going to get a bunch of ozone in your blood that way. It is useful for treating ulcers, particularly if you have an H. pylori infection, because the ozonated water will flat out kill that bug. I've cured a lot of ulcers with ozonated water, but it wouldn't be my favorite route to get ozone into your body if that's what you're trying to do. Rectal is probably the easiest. It's 50% as absorbed as an IV, and it's cheap and something you can do at home and does a good job of getting in the blood, but the water not so much.
Okay, great. Thank you.
Mm-hmm.
Someone also commented about CTCA. They had mixed up her scan code and gave her the wrong results, telling her she had metastatic cancer and it was wrong. Yeah.
Well, that's going to happen in any large hospital where the wires get crossed. Yeah.
Yeah. Okay. Another question on Facebook asking any advice on Gleason 7 prostate cancer, PSA 7 for 2 years. He's 56.
Spread anywhere or isolated in the prostate?
Not sure. I'll ask. Oops. If I can. In the meantime, I'll go back. There's another question. He has a HOCAT machine. What do you think of this machine?
I think it's brilliant. I am jealous that I have not yet got into one of these machines, but it's an infrared heater and a Rife machine and an ozone machine and a steam sauna, and it's kind of like the Swiss Army knife of natural medicine. And I think it's a very intriguing concept, and I'm excited to see how that would be useful. There's getting to be more and more of them around. Like it used to be that there was only 2 in the United States. Now a lot of major cities are getting them, and I think it's a very useful tool.
That's interesting. Very cool. The answer to the question about the prostate cancer spreading, the answer is no.
Yeah, so you've got this borderline, there's 2 types of I had a guy tell me there's 2 kinds of marriages. There's those that end in divorce and those that'll last forever. So there's 2 kinds of prostate cancer. There's the kind that are going to sit there and be there till you die, and then there's those that are going to spread and try and get you. And the trick is figuring out which one is which. Gleason 7 is right on the border of could this thing get out of the bag or not? How serious do I have to get about this? Probably his doctor would have said, unless he just told him to get it taken out, he probably just said, let's watch and wait, which also isn't a fun strategy because you're like, there's something, I'm sitting on something that's potentially a time bomb trying to get me. So I would definitely be addressing it. They're kind of stubborn in that, there's not a lot of blood circulation gets to the prostate. It's this little acorn that sits in your pelvis and it gets about 2% of your blood circulation. So if you take something orally, 2% of that's going to get to your prostate. So it's hard to get stuff there. Things like sitz baths, like 2 buckets of water, hot and cold, and you go back and forth, can get the circulation opening and expanding. And as you're doing a therapy, that can run it in better. So if you do that alongside whatever you're doing, ozone or IV vitamin C or the oral supplements with saw palmetto in it and things like that, you will have a better chance, I think, at getting that PSA down. So this is a good example of match the strength of the therapy with strength of the medicine, with the strength of the disease. So the gal with the husband with the liver and the lung, DEFCON 5. This one's DEFCON 2 or 1.5. So you don't need a whole bunch of fancy stuff, but you probably do want to put some pressure on it, but it's probably something he could get done with some local practitioners in whatever town he's in. But the proof's in the pudding of whatever gets that PSA to go down, that was probably what was working. So it's just a matter of monitoring and trying out different stuff. And yeah.
Okay. He said it's contained to the prostate. He's been taking cannabis oil for 2 years, also apricot seeds.
Cannabis suppositories can kind of get there a little better. I hate to say it, but a lot of the prostate treatments are rectal. Rectal ozone works pretty good. There's some heat therapies. It's something like a thermometer that the probe goes right kind of near the prostate and you turn up the heat. Cancer doesn't like heat. I remembered where I bought that thing, I could get them a link to where that machine is. But you just got to get the medicine direct contact with that area, which is you just got to be creative with.
Thank you.
Yeah.
Great. Yesenia asked, what do you think about PEMF?
I like it. It's once again not a anti-cancer therapy. It's pumps energy into cells to give them more oomph. But it's not like a laser gun going to melt cancer away or anything. So it's certainly useful, but more in the supportive therapy, like the hyperbaric, more than the anti-cancer therapy. But like I said, CHIPSA, we had one and we used it on everybody, and I think it's great.
Thank you. Someone's asking, have you heard of esthesioneuroblastoma?
Not specifically, but I know the category of what they're dealing with.
Okay, great. Okay, Simone, did you have a question?
Yes, one more
sorry,
question.
Cindy.
Oh, I'm sorry. Oh, I'm sorry. Just a quick question. What is your thought about baking soda bath or burdock root or bladderwrack herbs or soursop tea for cancer cells?
Yeah, I like the baths. Certainly we're acidic humans in a toxic world, and that does help detox and balance things out. It's a lighter therapy. It's not a strong agent, but a good gentle boost, and I think it's great. I like those.
Thank you.
Yeah.
Okay. Another question, how do you get rectal ozone treatments? What type of machines do you recommend? Are they well, we'll stop there. There's a couple more.
Sure. There's one company I like mainly because let me roll back historically. It used to be that you get any kind of machine, you'd fill up a bag, like a silicone bag with ozone, and then you'd squeeze it with a tube and it'd go into your colon and you'd absorb it. We found that you could get a stronger treatment by running the ozone right off the machine, but you have to find a machine that you can gauge at a low flow rate. You don't want to be filling yourself up with a whole bunch of air because you're just going to get bloated like the Safe Puff Marshmallow Man. So Longevity Resources is one that I like because it's got that dial. It's $2,000 or something. You can get a rectal treatment in most towns. I want to say they're going to run $50. At some point, you'll probably pay for itself by owning the machine. You do it at home. It's kind of a weird, place to stick ozone. It's kind of more fun just in your own bathroom at home. You'll have the machine forever. You can treat your kids for ear infections and clean out the garage, and it's just kind of a useful thing to have at home. Probably they should text me and I can call a company and have them do up an invoice with all the right attachments, because sometimes people order it online and they don't get all the right Tinker Toy attachments to do it right. But yeah, I think everybody in the world should have a rectal ozone machine at home just because it's so useful for so many things. You think about it's detoxing, colon cancer is something a lot of people get, and that can help break toxins down out of the colon. It gets into your blood. So I've treated sinus infections with rectal ozone because it just goes all the way through. So I think it's something useful to have.
That's pretty cool. She also asked, do you recommend silver pulsar for cancer therapy?
Silver what?
A silver pulsar.
That I haven't heard of.
Okay, it makes colloidal silver.
Oh yeah, colloidal silver for cancer is great. Yeah.
Okay, yeah, great. And then Cindy, who had asked about the COC protocol, she said, you've been most helpful. She loves your candor. You've been so informative. She has a lot of homework to do, but we'll be in touch with you regarding supplement support and to discuss CTC. I'm not sure if she means circulating tumor cells or the COC protocol.
Sure.
Yeah.
Happy to comment on both. Yeah. Tell her thank you, because my one desire is to be useful. So hope that I'm useful tonight.
Can I ask one more question? This is Yesenia.
Sure. Yep.
Hi, I'm currently on the Gerson therapy, well, as best as I can do with it. I'm not on the full protocol yet, and I do have a Gerson practitioner. From your experience, someone that had breast cancer secretory to lungs. Is it useful? Do you think Gerson will?
I think useful, but not as a standalone. So there's a good amount of discernment in when to know whether something is a good thing. Gerson is definitely a good thing. Is that the only tool that I would take with me in a fight with a saber-toothed tiger? No. I just think it needs more than that. So at CHIPSA, which used to just kind of be the Gerson diet center, now we have dendritic cell vaccine and IV vitamin C and ozone therapy and low-dose chemo. So I think stacking as many guns on your belt, especially in a bigger battle, is wise. So I think Gerson is one of those guns on the belt, but it shouldn't be the only gun on that belt.
Okay.
Which a lot of people say, oh, Gerson cures cancer. That's the only thing I need. So I'm educating, some people telling them that chemo's too much. The other people I'm telling that Gerson's not enough. So it's like I'm always moving people toward the path that's going to get the job done.
Perfect. Okay, thank you.
Yep. Hair's all screwed up. Okay.
Okay, and then I think Cindy said tonight's Zoom was very helpful to me. Thank you for the Zoom meeting. I think she'd also asked about Soursop or Burdock root.
Yeah, they're tonics. They're useful oral support. It's, like I said, not something I would rely on as my only cancer fighting agents, but they're certainly useful. And I use Burdock a lot more for liver detox and things like that, but I do think they're useful herbs.
Great. Okay, and one more question. Is there anything I can use with DMSO for my prostate cancer, please?
Right. You could do it in the IV. So if you're doing like an IV vitamin C, you can shoot the DMSO in. If you get the actual medical grade in an injectable vial DMSO, it does get to penetrate better, which fixes the problem of our hard to penetrate the prostate. It does stink up the whole room. And if you walk into a restaurant, you're going to still smell like that, and people are going to wonder what planet you're from. I stopped using it just because I couldn't handle the smell of it in my clinic.
It is pretty strong.
But topically, if you had a topical agent, I don't know what you'd use topically for prostate, but it's, it's something that if you put on your skin, that's going to help whatever else you put on with that, drive it through the skin. So we're getting, the strategy that's getting there in terms of getting something absorbed has an absorption problem. Yeah.
Cool. Does Apatone have many side effects?
No, IV or oral?
Not sure.
Oral, no, except for that it is a little acidic and it can give some people some heartburn. IV, yes. If you run it in too fast, they get this weird rash, like a mouth sore. Looks like a cold sore or something. So you just have to do it slow. And it does oxidize cancer in real time. So you can get pain at the tumor site as it's dripping in. Typically, you'll start putting people, ow, 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 like you'll feel it eating away that cancer cell in the moment that it's going in, which is very gratifying as a doctor, can be very uncomfortable as a patient. So you just got to, in that case, just mind the dose. If you do a lower dose, it won't burn as much. But most people are doing cartwheels if you can get them to feel pain in their tumor site. So usually they'll just bite something and deal with it.
Thank you. Yeah, the answer was oral.
Yeah, oral. Acid reflux sometimes, if that's the case, just take it with food.
Okay. Cindy, can you, is it safe to keep using, I'm not sure what this is, trimicin? Is that something, ointment for her skin issue?
Don't know what that is.
Oh, I'm sorry. It's a skin ointment for inflammation. I think it's triaminic. I'm pronouncing it incorrect, but they said use it on if I have any rashes or things. It's good for inflammation. It's like a white ointment of some sort.
I'd have to. Okay, the steroid's not going to be the best. So what a steroid? So most skin conditions are something bad in you trying to get out of you. What a steroid does is it takes and it shoves that back into you. Okay. So typical skin conditions, put a cortisone cream on it. Hey, it cured, it went away. 4 months later, it's back.
Okay.
You do it again and then it disappears again, but now it's in your kidney or now it's in your spleen. Like it actually just drives disease deeper into the body, which isn't what you'd want to do. You want that to come out. So, you know, the only reason we do use that is if it was so uncomfortable, you're ripping your hair out, get on it just to kind of get through your day. But I would use the other purgative strategies like the sauna and the ozone sauna and things to get stuff out of you rather than shove it back in.
And what about sesame oil or black cumin seed oil on the skin?
Those would be great. Yep.
Great. Okay. Thank you so much.
Yeah.
Okay, I got the name. It's triamcinolone. It is a steroid.
Yeah. So just say no to steroids.
Okay. Thank you.
Often as you can avoid them.
Okay.
Got great questions tonight, by the way.
Yeah. Okay, Cindy again. Alan says most helpful. Many thanks to you both for the prostate cancer questions. And then Cindy's back. I guess no homework. Is IVC contraindicated for hemochromatosis? For patients having hemochromatosis?
Yeah, a little, because it's going to help the absorption of iron. And then tell me while I'm thinking about it, the gal on the left over here that's using her daughter's computer, Cheryl.
I'm here. I'm here.
Yeah,
Cheryl.
do me a favor. If you're ever going to get an IV vitamin C or an ozone, there's a
Yes.
certain blood test you have to get first
Oh, okay.
that makes sure that you have the enzyme that breaks down vitamin C.
Okay.
Really, it's called G6PD.
PD?
Yep.
Okay.
So whoever you get a vitamin C with, make sure they do that test because
Okay.
it can put you in a world of hurt if they put a bunch of vitamin C into you can't break it down. It's bad things happen. So
Okay. G6P is a Peter, D is a Danny.
correct.
Okay. Thank you so much.
Yeah, you bet. And now I got distracted. I was talking about
The hemochromatosis for IV
Yeah.
vitamin C.
I don't think I've encountered that problem in clinical practice, but I would, yeah, we'd want to research that a bit because probably it's going to make it a little worse. If you are going to go get an IV vitamin C, I would just quiz out the doc there and just say, hey, hemochromatosis, is this a bad idea? And if they don't appear to know, like I don't, then maybe you should get a second opinion.
Okay, great. All right, I think we're gonna wrap it up. That was awesome. Thank you everyone for your questions, and thank you so much, Dr. Matt, for fielding all of those and answering them so thoroughly.
No, it was fun. No, we should do this again. Good time.
Oh, all right. Just one more. Another one
Sure.
just came in. Can Apatone oral help with stage 4 breast cancer while on chemo? She has metastasis to the pleura and her lung.
So if you take Apatone along with any chemo, it can enhance the absorption of that chemo like 500%. So they did a study of gemcitabine and Apatone, and it was something like a 600% better return than gemcitabine alone. So if nothing else, if all we did was hand out Apatone to all the chemo patients, everybody would do better. And they're going to battle you on that one because, oh, vitamin C, cancels out the chemo. Vitamin C is an antioxidant and it combats the oxidant attempt of the chemo, but Apatone is an oxidant because the K3 makes the vitamin C more oxidizing. So now it's pointing in the same direction as the chemo, not opposed. So it's helpful, not harmful. And if they give you any crap, they can call me and I'll debate them that topic because I love debating that topic. Because it is, and there's studies for it. They always, oh, there's not clinically studied. It's like, whoosh, here's 300 pages of studies on Apatone and chemo, and it works better.
Cool. Okay, Cindy, about the hemochromatosis, she's heterozygote for H63D. She says no doctors can answer, whether it's safe. The IV vitamin C.
I wouldn't do it. I would pick another therapy. And then what she got? This is the breast cancer? I would do, so in that instance, I would do artesunate. So I keep talking about artesunate. It's a single compound extract from the wormwood plant, specifically sweet wormwood, which has been used against cancer for a lot of years. Artesunate is the active principle, and it works by attracting itself to iron in cancer cells. So in her instance, where she's got a bunch of iron floating around, I would piggyback artesunate on that iron and go rip up some cancer cells. I would do that instead of the vitamin C.
Okay, and to clarify, it's endometrial cancer.
Same answer.
Okay, great. All right, and Alan says again, this guy's amazing. He knows his stuff. All right, well, let's wrap it up. Dr. Matt, is there any final words of wisdom for everyone?
Go do it. You know, cancer needs a solution, just like pneumonia has a solution with antibiotics. This is something that's on the rise. 1 in 3 people are supposed to get cancer in their lifetime. And as you can tell, there's not an army of qualified people that know how to deal with this. This is something that's our responsibility, all of us, to figure out answers for. And I don't have all the answers, obviously. There's a whole lot of stuff that's out there that I just haven't fiddled with, haven't tried. We got to figure this out because, you know, you look down the office, if there's 12 people in that office, 4 people are supposed to get it. You know, 4 people we care about. So we got to figure this out. We got to dial this in. So do stuff, try stuff, research stuff, tell other people about it. It's whatever works. You know, it's, if you're in the ring, mixed martial arts, and you got a judo guy and a kung fu guy, whoever is left standing up at the end of the fight, that was the right answer. So if artesunate worked and vitamin C didn't, it's artesunate. If Apatone worked and steroids didn't, that was the answer. So figure out what works, pass it on, and beat this thing together.
Amen. And prevent it.
Yes, and let's think way upstream and not get ourselves into these pickles.
Absolutely. Anne says, great interview. Thank you. Cindy says, thank you both so much. Suzanne says, thank you. Thank you so much, everyone, for coming. Thank you, Dr. Matt. I hope we can do this again soon.
That was great, Bailey. Thanks for inviting me.
Yeah, my pleasure. Victoria says, thank you also. All right. Have a great night, everyone.
Okay. Good night, guys.
All right. Bye. God bless.